Hi, Dr. Yass here. In this video, I'm going to discuss a potential cause of pain, which I am quite sure is rarely ever considered when trying to determine the cause of pain. So, as I've always discussed, if you go to the medical establishment, regardless of the specialty, their focus is on the use of diagnostic tests like x-rays or MRIs to establish what tissues in distress are eliciting your symptoms. And as I've always stated, this is a baseless concept. It's flawed in the fact that they find a structural variation like a herniated disc, stenosis, or arthritis, a pinched nerve, a meniscal tear, a labral tear, and simply because it's identified for the first time at the time you're having pain, it is perceived to be the cause of your pain, which is known as correlative theory, or junk science. We already established this is baseless. That structural variation has the highest probability of being there well beyond earlier than your symptom began, and therefore could not be directly correlated to the symptom. So I go on to say that over 28 years of diagnosing and treating people with pain and other symptoms, I've established that in more than 98% of cases, the cause is muscular. It's actually a muscle eliciting a pain. It primarily comes out in 4 different mechanisms. One, a muscle strains and elicits pain or causes another muscle to compensate, trying to assist that other muscle and elicit pain. Or you could have the muscles that attach to joints be weak or imbalanced, causing a misalignment of the joint surfaces, and that could cause the joint surfaces to rub in a way, so you could have a muscular cause, create joint pain. Then you could actually have a muscle referrer symptom, which I always use the example of numbness in the hand after sleeping on your side and sleeping on your shoulder as being actually referred from the rotator cuff, not nerves, not anything neurological, not from the neck, not from the spine. It is literally a symptom that is being referred from the rotator cuff because it is strained and being overstretched when you lay in that position. And finally, we have muscles that strain and can then impinge on a nerve, such as sciatica, which is irritation of the sciatic nerve. Therefore, the cause must occur within the path of the nerve. The nerve begins in the gluteal region and ends at the back of the knee. Therefore, there must be impingement of the nerve somewhere within that path. And actually, it's the piriformis muscle in the gluteal region in straining and eliciting, impinging on the nerve, which then elicits your sciatic symptom. Those are the 4 primary concepts of muscular causes. And I've stated that in more than 98, just imagine that, more than 98 out of every 100 people, their pain is muscular based. Even though you found the structural variation, you just have to learn to start to ignoring that, because the evidence is so overwhelming that those structural variations have nothing to do with pain. That's just a fact. So let's say that you're having pain in the right groin region, which is a somewhat common area for a symptom. The natural tendency, even if you are in the group of people that believe that the cause is muscular, you're going to assume that there's some sort of muscular deficit of the right leg because the symptom is being experienced in the right leg. I am here to tell you that in 30 to 40% of the population who have these type of muscular deficits creating their symptoms, the cause is actually coming from a strain of the opposite leg, the leg that is not experiencing the symptom. So in this case, you could strain the left gluteus medius muscle, which is the muscle responsible for helping you create balance and stability, keep your pelvis level, allow you to weight bear in the left leg with balance, also allows you to be able to swing your right leg through when walking and still maintain balance. So the gluteus medius is a primary muscle for balance and stability. Now, if that were to strain on the left side, it could actually cause the right lower back muscle to overwork. Once that strains, it causes the right hip to rise, and as a result, the distance that the right foot has to come down to the floor is greater than the left foot because the right hip is now higher. So in that understanding, there's an excess load that's created because the distance that the foot has to travel down to the floor is greater, and that load must be picked up by a muscle. And in this particular case, the groin pain is actually a result of a strained sartorius muscle. So this is an example where if you simply attempt to treat the side where the symptom is, you're going to miss the idea that the cause is the left gluteus medius muscle. the gluteus medius muscle on the leg that is not creating the symptom. And if you don't address that, and don't recognize it by the physical presentation of the body trying to present this to you, when you walk, you might find that you kind of side bend to the left every time you put your foot down. You would find that if you tested your left leg and tried to stand on the left versus the right, or squat on the left versus the right, it would be much harder on the left. The fact that the pelvis is higher on the right than the left, these are all aspects of physical presentations which would tell you that although the symptom is on the right side, the cause is the left leg. And you would actually have to strengthen the left leg to resolve the right side pain. We could go back to the idea of, let's say you're having right lower back pain. Just as I described in the episode prior, if the left glute med were to strain, the left gluteus medius, that muscle that helps support you and balance you on the left leg, the right hip would want to drop, and that could lead to a tripping hazard. If the right hip drops because the left glute med can't keep your pelvis level, well, your hip is going to drop, and the distance to the floor gets smaller, and that makes there be a possible tripping hazard. As your right foot's trying to come through, there's less room for it to travel through, and therefore you're going to trip. The body wouldn't allow that to happen. That's why the right lower back muscle, which acts as a basic string, if you will, from the bottom of the rib cage to the top of the pelvis, it's acting as a strap and pulling up on the right side of the pelvis to assist for the left glute med being weak. Well, it's not designed to do that, and as a result, it will strain. Once it strains, that right QL, again, that acts as a strap between the bottom of the rib cage and the top of the pelvis, will shorten, and it's going to cause that pelvis to rise. So that excessive load that right lower back muscle has to take, that QL, quadratus lumborum, it wasn't designed for that, so it might strain and elicit pain. So you'll have right lower back pain created by a left gluteus medius muscle strain. The left leg is the muscle creating the symptom on the right side. These are critical points. You must understand that in a muscular deficit, if you do not establish the muscles that are responsible for the symptoms being experienced and address those particular muscles, not all muscles. You don't do 30,000 exercises. You don't do general conditioning. You don't do the quad and the hamstring. You don't do both legs. If the left glute med is responsible for right lower back pain, you only strengthen the left glute med, plus a couple of other muscles associated with that. You wouldn't even be doing exercise on the right side, even though the symptoms are on the right side. This is clearly counterintuitive to the basic balance of the human population. Unless you're recognizing that symptoms are created by specific causes, and the goal is to establish what the cause is. In this case, if it's muscular, which particular muscles are responsible for the symptoms. So if you've had right lower back pain, right groin pain, right ITB, right ankle pain, and you've gotten all this treatment on the right leg and it hasn't helped, well, here's your wake-up call. Maybe that's because the cause of the pain on the right side isn't coming from the right side, it's coming from the left side. And you need a physical evaluation, a way to interpret what the body's trying to show to know this. And that's what's at the core of the Yass method. I just did a Zoom session this morning, and it was a very similar premise. The guy had the right groin pain. It was clearly a sartorius. But when we evaluated him, we could see it was much harder for him to single leg stand on the left, single leg squat on the left. When he walked, he actually side bent to the left. When he walked, his pelvis was higher on the right. All these things were indicating, when we muscle tested him, the right glute med was extremely weak on the left side, not the right side that he had his symptom on. When we touched it, it was incredibly tender at the left glute med, no tenderness at the right glute med. And this guy and anybody who would ever come to treat him assumed that his symptoms were on the right side and he just simply wouldn't get better. Once we identified the causes being on the left side, that it was the left glute med, we did specific exercises, and the guy, basically the right groin pain went away within the first session. It was gone. And he was walking better. And he was shocked at how he was more centered when he weight bared. And when he walked, he didn't have the side bending as much. All from one session identifying that the left glute med had strained, causing the right groin muscles to strain and elicit the pain. This understanding can only come from the ability to interpret the body's physical presentation of symptoms. That is what is at the core of the Yass method. As far as I am aware, I am the only practitioner, the only method that literally looks at the body's physical presentation to identify what tissues in distress. As I said, when it's muscular, you can identify which particular muscles. And again, you have to do what is known as purposeful exercise, prescriptive exercise, which is to say you only strengthen the muscles associated with your symptoms. That's how you resolve the symptoms. When you are asymptomatic, then you go on and you do general conditioning. But other than that, if you're having a symptom, you must only strengthen the muscles associated. As far as I know, the Yass method is the only path to this resolution. This is the only way to understand what tissues in distress and if it's muscle, which particular muscles. And there is the high probability that it could be that the muscles that strained are actually in the leg that is not creating the symptom, that you are not having the symptom in. And the Yass method is the only way that you will be able to identify this. That's just the way it is. So this is your chance. Again, I put these videos out to create awareness, to give people the opportunity so they don't have to live in pain forever, so they don't reach that point of hopelessness, depression, maybe even suicide, so that they know that there is a legitimate alternative, that there is a way of understanding what's causing their pain, that there is a way of identifying the true cause and therefore be able to resolve that cause. Once you establish the cause, the tissue in distress, it's not very hard to resolve the cause. You just have to figure out how to resolve the distress of that tissue. In muscle, it means strengthening must be involved. Not ultrasound, not electric stim, not cold laser, not decompression, strengthening against resistance, causing the appropriate muscles to adapt to greater and greater resistances, eventually to the point where their force output is greater than the force requirement of your activities. You don't have symptoms. So if this is making sense to you, again, as I always say, and you have a question about your situation and you'd like to contact me, you contact me by email at drmitch@mitchellyass.com, DRMITCH at MITCHLLYASS.com, drmitch@mitchellyass.com. If this has made enough sense to you that you want to set up a Skype or Zoom session, by all means, contact me by email, drmitch@mitchellyass.com, DRMITCH at MITCHLLYASS.com, drmitch@mitchellyass.com. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe so you can get notifications when new videos are added or when I'm live on YouTube. This channel is 100% dedicated to you. It is not for the glorification of me. It is so that I can provide you the information that helps you understand how to identify the cause of your pain and resolve it. You're not getting it from the medical system. That's evident. So you need an alternative. This is your alternative. This sits outside the medical system. I'm telling you that in 98% of cases, the cause is muscular, and therefore no aspect of the medical field can resolve muscular deficits. It's just the reality of life. You have to be in a fitness-based area, and the Yass method is based in the fitness understanding of the relationship of symptoms to dysfunction. So this is your place. This is your time. Take the first step. Contact me. Let's move ahead. Let's identify the cause of your pain. If it's muscular, let's give you some exercises, and within a few weeks, you'll be pain-free and fully functional. And you'll have your life back. And you'll no longer be a prisoner of the system, the medical system, and you'll be in control. You need to get more strength, increase the resistances, get stronger, and have no symptoms. It will all be up to you. You will have control of your life again. All right? For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.